disinfectant and burnt plastic, and underneath it the sweetness of a pediatric ward in the afternoon, apple juice, crayons warming in fluorescent heat. I know that smell the same way I know aviation fuel and oxygen masks and cold, dry air at 14,000 feet over terrain that does not care whether you are ready. They called me the quiet one. The nurse always there before anyone noticed, gone before anyone said thank you. I had cultivated that for 20 months. And then 6 AH-60G Pave Hawks came in over the Tucson mountains. 3 to the rooftop helipad, 3 to the parking structure, a split formation, and the only name they carried was one I had left at Davis-Monthan Air Force Base 3 years ago. Let me tell you what happened when they brought it back. My name is Lena Okafor. I am 41 years old. I have a tremor in my right hand that appears only under significant stress and that I have spent 6 years training myself to suppress. The kind of work I did before this work required that hands be reliable regardless of what the rest of the body is doing, and so they are. Most people never see it. I close my right hand around whatever I am holding and wait between 4 and 9 seconds, and it stops. The tremor is the only thing I brought back from Paktika province in 2018 that I did not choose to bring, and I have made my peace with it. I had been a regular staff nurse at Redemption Medical Center in Tucson, Arizona, for 20 months. Regular staff, a locker with my name on it, a predictable schedule, a department I knew to the granular level, the supply cart that listed left and needed a wedge, the medication dispenser on Base 6 whose screen froze if you tapped too fast, the afternoon light through the west windows at 4 o'clock, that turned the ped bay into somewhere that looked briefly like nothing bad could happen. I worked pediatric emergency on the first floor, attached to the adult ER by a double door I had pushed through so many times I no longer noticed. To the ped staff, this department was everything. Personal. You cannot work pediatric emergency and stay at professional distance, and nurses who tried did not last. To me, it was the most precise version of the work. Children's physiology leaves no margin for imprecision. Every drug, every dose, every line had to be exactly right, and I had learned exactness in environments that demanded the same thing with higher stakes. This department used everything I had brought back. All of it. I cataloged exits the way I always have. Ambulance bay doors, north face, fire stair, east end, staff entrance, parking structure, key card, rooftop helipad access via the elevator bank, civilian medevac only, 1 aircraft at a time, and the parking structure roof, open air, 3 levels, rated for vehicle load. My body made the note in week 3. I did not know I would need it. My hands were the currency of every shift. IVs in veins the width of thread, dosing calculations ahead of the pharmacist's confirmation. Wound assessments on patients who could not tell me what hurt and could not hold still. The right hand. I was aware of it the way you are aware of a door you keep closed, not locked, just not opened. I had a system. Dr. Warren Schiff had been the head of Redemption's Pediatric Emergency Department for 6 years, which in the language of hospitals meant that the department had been organized around his preferences for 6 years, and had stopped noticing that it was. He was 53, silver-haired, with the particular ease of a man who has not been wrong in a room he controlled for long enough that he has stopped expecting it. He was not unkind. I want to be precise about this. He was not cruel in the way that some people in authority are cruel. He did not seem to enjoy it. He was, instead, a specific kind of man who has confused certainty with correctness for so long that the two have become the same word to him, and the error does not register because it has never had consequences. Until that Tuesday. He found me at Bay 4 at 2:17 in the afternoon, where I was reviewing a medication order for a 7-year-old admitted with a severe allergic reaction. The order read, Neuro, 15 mg of epinephrine intramuscular. The child weighed 19 kilograms. The weight-based dosing calculation for epinephrine in anaphylaxis is 0.01 mg per kilogram, which for 19 kilograms is 0.19 mg. 0.04 of a milligram. In adults, this is noise. In a 7-year-old, it is a cardiac conversation. I flagged it. The order should read 0.19, I said. The child is 19 kilograms. Schiff looked at the order. He looked at me with the expression of a man receiving information he has already evaluated and dismissed. I'm aware of the child's weight, he said. His voice carried to the 3 residents clustered at the medication cart and to the charge nurse at the station, because Schiff's voice always carried, and he always knew it did. 1015 is my clinical judgment. There's a margin in the literature for conservative dosing in young patients. Not in anaphylaxis, I said. The margin is for mild to moderate allergic reaction. This is anaphylaxis. I kept my voice even. I kept my hands still. 1019 is the correct dose. He looked at me for a moment with the specific quality of attention of a man deciding whether to engage or conclude. He concluded. Administer as ordered, he said to the charge nurse, and walked away. The charge nurse looked at me. I looked at the order. I administered as ordered. 14 minutes later, the child's pressure dropped. The cardiac monitor alarmed. Schiff returned to Bay 4 with the rapid, controlled movement of a man who is already revising his account of events, and he administered a second dose. The correct dose, 0,019 milligrams, and the child stabilized and was fine, and went home 4 hours later with her parents, who did not know what had almost happened in Bay 4. I stood at the nursing station afterward and was quiet for a while. My right hand was doing the thing it does. I closed it around a pen and held the pen and waited the 7 seconds, and it stopped. I did not document what I had said and what had been ordered and what had happened, because I knew what documenting it would do to my position here, and my position here was the life I had chosen. I did not confront Schiff. I went back to work. That is the thing I am not proud of, and I have thought about it every day since. The child was fine because of a second intervention, necessary because of the first, which I knew was wrong and administered anyway. There is no version of that accounting that comes out clean. I went back to work. There was a woman in Bay 11 whose name was Rosario P., 78 years old, admitted for a hip fracture following a fall at home, and waiting for orthopedic consult in the pediatric Bay overflow area, because the adult ER was at capacity. She was not a pediatric patient. She was a woman in her late 70s in a department built for children, and she looked around at the crayon drawings taped to the walls and the stuffed animals on the supply cart's top shelf with the expression of someone who finds the situation bemusing rather than distressing. She had a photograph on the table beside her bed, turned so she could see it from the gurney. 2 women in military uniform, herself, decades younger, and another woman I did not know, at what appeared to be a field station, somewhere warm. She wore the insignia of the Army Nurse Corps on her collar. Vietnam, she said, when she caught me looking. 71 to 73, 12th Evacuation Hospital. I checked her hip, her vitals, her IV line, which had drifted slightly and needed resecuring. You're careful, she said, watching my hands. Trying to be, I said. Army, Air Force. She looked at me with the recognition of someone who has identified a category from very few data points. Ch, she said. I stopped resecuring the IV for a moment. Nobody in this hospital had ever said that word to me. Was, I said. There's no was, she said. not unkindly, the way you say something you know from the inside. I finished the IV. I documented her vitals. I straightened her blanket because it needed straightening. "You're going to be fine," I said. "The ortho consult is in about 40 minutes. "I know I'm fine," she said. "I've been fine for 78 years. I'm wondering about you." I looked at her for a moment. I was aware of the right hand. Faint. Present. "Get some rest, ma'am," I said. She smiled with the half of her face that was not tired. "Yes, ma'am," she said. I heard them at 4:53. I was at the medication dispenser on Bay 6, the one whose screen froze if you tapped too fast, entering a draw for a 4-year-old in Bay 6 with croup. The sound arrived in my inner ear before it arrived in the room. The specific frequency signature of H-60G Pave Hawk rotors, which I can distinguish from a standard medevac helicopter, the way a musician can distinguish a viola from a violin by the weight of the note. Lower fundamental frequency. More mechanical resonance in the airframe, the sound of a machine that was built to go places civilian medevacs were not. I stood completely still. And then the sound split. That was the part that told me everything. Not one formation on a single approach vector, but 2 simultaneous arrival sounds from different headings: rooftop helipad, northwest, and parking structure, southeast. A deliberate split. Weight distribution across 2 landing zones because the load was too much for one. I had executed this configuration in training, and once in Paktika province, and I knew exactly what it meant. 6 aircraft. Split formation. Combat search and rescue profile. I put the medication draw in my pocket. And then I walked to the window. 3 Pave Hawks were descending to the rooftop. 3 more were coming down on the parking structure's open roof, 3 levels above the street. Even from the first floor, I could see the downwash displacing the dust from the Tucson afternoon, a widening halo of disturbed air above the parking structure's concrete lip. My right hand was doing the thing. I closed it around the medication draw, and I waited. And it stopped. "Not here," said the part of me that had been saying this for 3 years. "You are the regular staff nurse. You are the quiet one. This is not yours." I stood at the window for 4 seconds. And then I walked to the double door between the pedwing and the adult ER. And then I pushed through it. The adult ER was already reorganizing around something large. I could feel it before I could see it. The quality of acceleration that moves through a department when a crisis is inbound and the department knows it. The charge nurse, Devin, was at the station with his phone to his ear, and the face of a man receiving information faster than he can process it. 2 residents were at the trauma bay entrance. The attending on duty, Dr. Faisal, was pulling on gloves. I went to Devin. "What's coming?" I said. "Air Force crash crew," he said. "Training exercise. Went wrong. Multi-system trauma. They're saying blast injury, burns, 1 traumatic amputation, 1," he looked at his phone, "1 airway compromise." Airway compromise. I knew what that meant in a blast injury context. In a blast injury context, airway compromise with a traumatic mechanism meant swelling and debris, and the possibility of a pathway that was closing faster than intubation could catch it. In a context like this, the answer to a closing airway was not always intubation. Sometimes the answer was a hole below the problem. "I need a cricothyrotomy kit," I said. Devin looked at me. "Surgical airway kit," I said. "Scalpel, hook, trousseau dilator, cuffed track tube, size 6. I said it the way you say a list that you have said before, which I had, in conditions where saying it wrong meant someone died. "Do you have one?" "Trauma supply room," he said. "But the attending, I need it staged at Trauma Bay 1, I said. "Now, and I need Dr. Faisal to know what's coming." I looked at him steadily. "Go." He went. Schiff appeared at the double door between the wings. He had heard the rotors, everyone had, and come to find the source of the reorganization with the bearing of a man who intends to re-establish command of a room that has moved without him. "What is going on?" he said. "Air Force crash crew inbound," I said. "Multi-system trauma, 1 airway compromise. I'm prepping a surgical airway kit. You are a regular staff nurse," he said. His voice was measured. It was the voice he used when he was most certain. "You do not prep surgical airway kits. That is not your scope." I looked at him. "That is not your scope," he said again. And then the first helicopter landed on the rooftop, and the sound of it moved through the building's concrete and into the floor, and I felt it in the soles of my feet the way I had felt it 100 times before, and the right hand made the shape it makes, and I closed it around the empty. Medication draw, and I waited, and it stopped. "Step aside, doctor," I said. My voice was not loud. It was the voice that belonged to a different context, a context of aircraft and altitude and the specific quiet of a casualty who needs you to be the most capable person in 100 miles and to perform like it. I had not used it in 3 years. It had not forgotten how to be itself. Something in the room shifted. Devon had stopped moving. The 2 residents were very still. Schiff looked at me for a long moment. He looked at my hands. He looked at my face. He stepped back. I went to Trauma Bay 1. The first gurney came through the bay doors at 17:02. A staff sergeant named Thorne. Blast injury, left arm amputation above the elbow. Tourniquet applied by the medic on scene that was holding correctly, and that I confirmed and marked with a time and did not touch. Because the correct response to a correct tourniquet is to leave it and move to the next problem. His pressure was 90/60, trending, 2 large bore IVs. O negative running. I handed him to the resident. And then I moved to the next bay. The second gurney was the airway. Technical Sergeant Aurelio Vega, 28 years old. Blast injury to the face and neck. The right side of his neck was swelling in the specific way that told me the clock on this problem was already running. He had a GCs of 14. His oxygen saturation was 92 and moving in the wrong direction. The medic with him was a young staff sergeant who had done everything correctly on scene, and who looked at me with the specific expression of someone who has been managing a problem for 30 minutes and needs someone to take it from him. "He wouldn't tolerate the NPL," she said. "Tried twice. I see it," I said. I looked at Vega. "Sergeant Vega, I'm Nurse Okafor. I'm going to fix your airway. You're going to feel pressure on your throat. Stay still for me." His eyes found mine. He nodded. 4 millimeters, but present. The cricothyrotomy kit was on the tray. I had laid it out before the gurneys arrived. Scalpel, hook, dilator, track tube, cuff syringe. The order of it was the muscle memory of a procedure I had performed 7 times in the field, twice at altitude. Once with my right hand doing the thing it does and being overridden by the fact that this was not a moment for the hand to have opinions. I found the cricothyroid membrane by palpation, 2 fingers from the thyroid cartilage, inferior notch, the small depression between the thyroid and the cricoid. I confirmed it with the horizontal stab technique the way I had been taught, which is not the way it appears in most nursing curricula. Because most nursing curricula do not assume you will be doing this in a forward combat zone with rotors overhead and a man's blood on your hands. The airway opened, and then the oxygen saturation climbed. 92, 94, 96, 98. The curve of it on the monitor was the most reliable thing in the room. I stepped back and let the attending in, and I watched his hands confirm what I had done, and he looked at the airway and he said nothing for a moment. Then, "Get the ent on the phone." This man needs a formal track in the ore. And then, quietly, to me, where did you learn to do that? I was already moving to the next bay. I'll explain later, I said. At 1740, the adult ER had the quality of a room that has just been through something and is taking stock of itself. Vega was on his way to the ore. Thorne was in surgery. 2 other members of the crew were in bays, stable. The military medics who had come in with them were in the corridor, doing the specific quiet thing that military medics do when the work is done and the adrenaline is still in the room. Standing, accounting for everyone, making sure the count is right. There was a woman at the nursing station who had not been there before. She was in Air Force flight gear, tan flight suit, patches I recognized before I consciously read them. She was 45 or so, with the particular composure of someone who is the ranking medical authority in a given situation and has been that for long enough that it reads in the way she occupies a space. She had a tablet in her hand, and she was not looking at it. She was looking at me. I walked toward the station. Lieutenant Colonel Vera Akabe, Air Force Special Operations Command Surgeon. I knew her the way you know people from a different part of your life when they appear in the current one, with a delay between recognition and acknowledgement, the brain checking its own work. Devon was beside her. Schiff was at the corridor entrance, still, watching, the last 2 hours of revision visible in the set of his shoulders. Achebe looked at me. "Angel," she said. One word. No question in it. The word carried the weight of 183 registered hours and 3 operational deployments, and a citation she had written herself and that she had in her memory rather than in a folder, because some things you carry rather than file. I was the only person at the nursing station who did not look around to find who she was addressing. I looked at my hands. The right one was still. It had been still since Vega's airway. It had decided, apparently, that this was not the moment. And then I looked at Akabe. She had already found me. She had found me the way people find you when they know you are somewhere in the room, not by searching, but by confirming. I walked to her. 4 feet. I stopped. "Ma'am," I said. She looked at me for a long moment with the expression of someone seeing a thing she has been waiting to see for a while. "Vega is going to make it," she said. "First, the right hand. The thing it does." I closed it and let it do nothing. "Good," I said. She turned. Not dramatically, the way you turn when you have something to say and the room is the recipient. Devon was there. The residents were there. The 2 remaining medics from the crew were in the corridor doorway. Listening, Schiff had not moved from the corridor entrance. "Technical Sergeant First Class Lena Okafor," she said, without the tablet, without notes, from the place where she kept the things worth keeping. "Assigned to the 38th Rescue Squadron, Davis-Monthan Air Force Base, Tucson, Arizona, 2009 to 2021. Pararescueman. The Air Force does not use the word pararescue woman. I want that noted. Assigned to combat search and rescue operations in Afghanistan, Syria, and one theater I am not going to name in this room." A pause, not performed, just the weight of it. "Air Force Commendation Medal, Air Medal, the Air Force Cross," and here Devon made an involuntary sound. Very small, because the Air Force Cross is the 2nd highest decoration the Air Force awards and is not common. Awarded for actions in Paktika Province 2018, in which Technical Sergeant Okafor, operating as the sole remaining medical specialist following the incapacitation of 2 teammates, performed 3 simultaneous critical interventions on separated casualties under sustained enemy fire, refusing extraction until all 3 personnel were stable and the last one was in the air. Akabe paused. She was wounded in the same action. She didn't mention it in her report. Another pause. Her call sign was Angel, because that is what pararescue calls themselves, and because it was also what the men she brought back called her, separately, without knowing the others had used the same word. The 5 Air Force medics in the corridor came to attention. The sound of it, 5 bodies, simultaneously, the specific terminal shift of people who know how to do this, moved through the room the way sound moves through a building after something lands. Akebe raised her hand. The salute was full and precise. Behind her, 5 more hands rose. And in the doorway of the corridor, the medic who had been with Vega on the gurney, Staff Sergeant Morella Kosick, who had done everything right on scene and handed him to me with 30 minutes of correct work already logged, raised her hand as well. 6 salutes. I stood straight. I was aware of the sound of the last Pavehawk finishing its shutdown cycle on the parking structure roof above us. The rotors decelerating, the turbine note dropping, the specific quiet that follows a Pavehawk going to rest. And then I brought my right hand up. Clean, still, and I held the salute. In the corridor, Rosario P. had been moved to a gurney waiting for orthopedic consult. And she was watching through the double doors window with the photograph of her younger self and the Army Nurse Corps collar insignia in her hand. And the expression on her face was the expression of a woman who has been waiting for a long time for the world to show her something she already knew was true. Schiff was at the corridor entrance. His arms were no longer folded. His hands were at his sides. Whatever revision he had been conducting for the last 2 hours had reached its conclusion, and the conclusion did not fit the face he had available. Akebe spoke quietly to Devon and to the charge physician. I did not hear all of it. I heard department administration, patient safety documentation, the dosing incident on this afternoon's shift, and the particular tone of a person who is not suggesting a course of action, but ensuring its occurrence. I went back to the Ped Wing at 18:15. The afternoon light through the west windows had moved past 4 o'clock into early evening gold. The crayon drawings on the wall were the same ones that had been there in the morning. The stuffed animals on the supply cart's top shelf were in the same positions. The cart itself was still listing left, still needed the wedge under the wheel that I had been meaning to request from maintenance for 6 weeks. I requested it. I sent the message on my way to Bay 11. Rosario P. was back in the overflow bay, her hip still waiting for the orthopedic consult that was now 20 minutes out. She had the photograph on the table and the expression of a woman who is comfortable with her own company. She looked at me when I came in. She looked at my hands. "Well," she said. Well, I said. I checked her IV. I documented her vitals. I straightened her blanket because it needed straightening, and because some things you do not stop doing just because the room has changed. "Angel," she said. Not a question. "Was," I said. She shook her head. Slowly, with the certainty of someone who has been on the other side of the equation. "I'm not Angel anymore. I left her on the tarmac at Davis-Monthan 3 years ago. What remains is the hands and the tremor I keep closed, and the way I move through a room where someone needs something. That others may live. It still is." If tonight's story stayed with you, if Lena's story is one you're going to carry, hit that like button and share it with someone who needs to hear it right now. Subscribe to this channel. We tell the stories of the ones who never asked for recognition and learned to live without it. And drop a comment below. Tell me what city you're watching from tonight. I want to see how far this one goes.